How close are we to preventing RA entirely? Imagine a future where rheumatoid arthritis could be stopped before it even starts. While that sounds promising, current science shows we are not quite there yet. But significant progress is happening, especially in identifying people at risk and trying early interventions. Researchers have learned that the disease process begins long before symptoms appear. Blood tests can detect markers like anti-citrullinated protein antibodies, which can predict a higher chance of developing RA. This early detection is key because it allows scientists to explore ways to prevent the disease before joint damage occurs. Several clinical trials have tested whether early use of certain medications can delay or prevent RA. For example, the Apipra trial used a drug called abatacept, which modulates the immune system. During treatment, only 6% of participants developed arthritis compared to 29% on placebo. That's a promising sign that early treatment can slow down or delay disease onset. However, once the treatment stopped, the protective effect faded, and more people eventually developed RA. This shows that while early intervention can buy time, it does not yet offer a permanent solution. Other drugs, like hydroxychloroquine, which is often used to treat RA after it develops, have not been effective in preventing the disease in people who are at risk. This highlights how complex RA prevention really is. Researchers are also exploring new ideas, such as nanoparticles delivering immune-regulating agents like vitamin D derivatives. These innovative approaches are still in the experimental stage and are not yet approved for routine use. One of the biggest challenges is predicting who among those with risk markers will actually develop RA. Not everyone with autoantibodies will go on to have symptoms. Large research networks are working to better understand these patterns over time, aiming to improve risk prediction and develop personalized prevention strategies. Ongoing research is focused on understanding what triggers RA in the early stages, improving biomarkers to identify high-risk individuals more accurately, and testing new preventive treatments. While we are not yet able to prevent RA entirely, these advances are moving us closer to that goal. For people who are at risk or newly diagnosed, it's important to work with healthcare professionals to develop a personalized plan. Continued research and clinical trials are essential, and in the future, prevention may become a routine part of managing rheumatoid arthritis.